Hi, my name is Jocelyn Gia. Here's my badge. Okay, so before I begin my medication administration, I would first make sure to limit interruptions. I would keep the door closed. I would not take any phone calls. I would keep conversation with colleagues to only essential information, and I would follow my agency's no interruption zone policy. So to begin, I'm going to be comparing my order to my MAR. So we have patient Jaguar J. Jones, date of birth 8/25/63, date of birth 8/25/63, medical record number 4176352, medical record number 4176352. Patient has an allergy to penicillin. The medication we're going to be administering is Novolin regular insulin. I have Novolin regular insulin. The dose is 10 units. The route is subcutaneous. The time is 30 minutes before meals, and the time is 30 minutes before meals. And the right indication is for high blood glucose or diabetes. So now I'm going to move my order and just look at the MAR. I'm going to perform hand hygiene, and I'm going to begin my first check of the 7 rights of medication administration. So first we have right patient, Jaguar J. Jones. Right medication is Novolin regular insulin, and I have Novolin regular insulin. The expiration date is 12/1/25, so it is not expired. The right route is subcutaneous, so I'm going to be using my insulin safety syringe. And the right dose is 10 units. So I'm going to begin by cleaning my vial. I'm going to take out my syringe. I'm going to draw back 10 units of air. I'm going to uncap my needle, inject the 10 units of air, and then draw back 10 units. Okay. I'm going to recap my needle, and there is my 10 units. And then I would verify the dose with another nurse. Okay, so we did right medication, right route, right dose. The right time is 30 minutes before meals. The right indication is for high blood glucose or diabetes. And the right documentation is that all elements of a legal prescription are included. So now I'm going to perform hand hygiene again. I'm going to begin my second check of the 7 rights of medication administration. So the first one is right patient. We have Jaguar J. Jones. Right medication is Novolin regular insulin. I have Novolin regular insulin. The right dose is 10 units, and I have 10 units drawn up in my syringe. The right route is subcutaneous, and I'm going to be using the abdomen because that is the preferred injection site. The right time is 30 minutes before meals. The right indication is for high blood glucose or diabetes. And the right documentation is that all elements of the legal prescription are included. So I'm going to grab a piece of tape, place it onto the syringe. I'm going to write the patient's name, Jaguar J. Jones. The right medication, which is Novolin regular insulin, and the right dose, which is 10 units. So there is my label. I'm going to take my syringe, my vial, and my MAR to the patient's bedside. The first thing I'm going to do is perform hand hygiene. I'm going to raise the patient's bed to working height. I'm going to lower the side rails, position the patient comfortably. I'm going to explain the procedure to Mr. Jones. So Mr. Jones, we're going to be giving you your insulin injection 30 minutes before your meals for high blood glucose or diabetes. And so now I'm going to correctly identify the patient. So we have patient Jaguar J. Jones. Jaguar J. Jones, date of birth 8/25/63. Date of birth 8/25/63. Medical record number 4176352. Medical record number 4176352. Patient has an allergy to penicillin. Mr. Jones, is there any other allergies I need to be aware of? No. Okay. And so this is when I would perform any pre-assessments like lab values or blood pressure before beginning the medication administration. So now I'm going to begin my third check of medication administration. So I'm going to make sure I have the right patient. Jaguar J. Jones, right medication, no blood regular insulin. I have no blood regular insulin. The right dose is 10 units, and I have 10 units drawn back in my syringe. The right route is subcutaneous. The right time is 30 minutes before meals. The right indication is for high blood glucose or diabetes. And the right documentation is that all elements of the legal prescription are included. So now I'm going to perform hand hygiene again. I'm going to put on my gloves. I'm going to put on my goggles. And so first I would select the correct injection site. So I'm going to be using the abdomen. I'm going to make sure to stay below the costal margins to the iliac crest. I'm going to stay 2 inches around the umbilicus without going below the pubis and staying in between the anterior superior iliac spine. And then I would inspect the skin for any bruising, inflammation, and if there was any, I would choose a different injection site. So now I'm going to clean the injection site. I am going to uncap my needle. If I can grab 2 inches of skin, I'm going to do it at a 90-degree angle. If I can only grab 1, I'm going to do it at a 45-degree angle. So I'm going to use a 90-degree angle. I'm going to put the alcohol pad over, applying pressure, but not massaging. I'm going to dispose of my needle in the sharps container. And now I would position the patient comfortably. I would lower the bed. I would raise the side rails. I would assess to see if the patient had any allergic reaction to the medication. I would now take off my gloves. I would perform hand hygiene. And then this is the part where I would go and document how the patient tolerated the procedure, if they had any pain. And then after documenting the medication I also gave them, then I would, depending on my hospital's policy, I would come back and reassess the patient and see how they responded to the medication.